to our weekly episode of Beauty Out of Maya, the story of Raziela miracle and the way she's defined the odds of cerebral palsy and autism spectrum disorder. We are very delighted that you are here to cheer us on. Please subscribe on this channel and keep in tune with our weekly episodes. Kindly turn on your notification bell so that you don't miss out on any of our weekly episodes. Last week, I promised to tell you a little more about the silent seizures that led to asphyxia, leading to cerebral palsy and autism spectrum disorders in Raziela's life. And yes, here we are. In June 2010, Raziela developed frequent silent seizures following the CMV infection. However, the medics diagnosed her of preterm apnea attacks. And in a layman's language, a preterm apnea attack is where the brain forgets to send signal to the lungs to breathe. And that happens in a preterm baby due to prematurity of the brain. It is a condition in which premature infants stop breathing for 15 to 20 seconds during sleep, and most often occurs in preemies or preterm babies that were born 32 weeks or less. And remember that Raziela was born at 30 weeks gestation period. Also, the other thing is that the lower the infant's weight and level of prematurity at birth, the more likely he or she will have apnea attacks. And Raziela again had 1750 grams at birth. And so I think the medics looked at the fact that she was born at 30-week gestation period. That means that she was preterm, and then her birth weight was also less than 2 kgs, 1750 grams. And with that combination, they concluded that she could be, or she must be, suffering from apnea attacks, preterm apnea attacks. However, allow me to mention that preterm apnea attacks ought to stop once a child gets to the time of the mother's expected date of delivery, what we call EDD. My EDD for the twins was to be on May 22nd, 2010, and the baby was way past the age of getting preterm-related apneic attacks because this convulsive disorder, the silent seizures, were happening sometimes towards the end of the month of June. So she was way past her EDD day. But the team did not factor in that information before also concluding that Raziela was getting apneic attacks and also explore other things that probably she was going through. Now, let me also mention that most often preterm apneic attacks are accompanied by the bradycardia, which is slow heart rate, and which can be referred to as A's and B's. Bradycardia in newborn is characterized by slowing down of the heart rate to below 100 beats per minute. And newborns, especially premature babies, commonly suffer from bradycardia, which can be accompanied with interruption in breathing. And so apnea attack occurs when baby stops breathing for more than 20 seconds. And bradycardia describes an unusually slow heart rate. And if apnea and bradycardia are properly managed by the medical professionals, there may be no long-term negative effects. But if apnea and bradycardia are more severe and they are not promptly addressed, they may result in brain damage and even death. Among some of the drugs used to manage apnea are aminophylline drug. And this is the drug that was used on Raziela. Now, one of the side effects of aminophylline drug is that it triggers convulsions. And so here is a little girl that was already having a convulsive disorder, silent seizures, and then she was being treated by aminophylline drug that triggers more convulsions as a side effect. And so they treated Raziela for apnea for over a month without improvement. And instead, the attacks became very frequent. And they were frequent to the extent that some doctors actually began to make light of the moment. They took it lightly. And I think they didn't mean bad. Get me right, they didn't mean bad, just that they were trying to make a joke out of it as they treated her, so that we don't just go gloomy. The situation was already gloomy enough, and so they wanted to make it look a little bit more cheerful. And so they will joke about it and say, there goes Miracle. She's decided to stop breathing again, as they went to attend to her. It had become like it's the order of the day. And at times it's like she did it herself whenever she wanted. And during the attacks, she would silently pass out and stop breathing. She would not throw fits or foam. Hers were very silent. However, she would lack oxygen and turn purple on her lips, hands, and feet. Turning purple on her lips, hands, and feet was an indication that blood circulation was not flowing very well. I mean, oxygen levels were not very good circulated in her blood. And at one particular moment, her entire body turned dark blue, and especially the forehead. The forehead literally turned dark blue in my hands. And that was very scary, which I learned was an indication that major organs in her body were beginning to lose oxygen. And so she ended up with a condition, lacking oxygen on her brain, which is termed as asphyxia. And asphyxia is a condition that if oxygen supply to the blood and tissues is reduced because of interference with respiration, you end up being affected, and it's also called anoxia or anoxemia or hypoxia. And so Raziela ended up with this. Causes of asphyxiation are many, and one of it is seizure. When a person has a seizure, they may experience pauses in breathing called apnea. And so this is actually what was happening in Raziela. She was actually having seizures that were leading to apnea. And so it was okay that, the medics knew she had apneic attacks. She had those, whatever, but they didn't give her drugs to stop the convulsive disorder. Instead, they gave her a drug that was supposed to trigger her to breathe. And the drug caused more convulsions. And that is what then led to injury on her brain, leading to cerebral palsy, autism spectrum disorders in Raziela. But on top of that, Raziela had also suffered bronchial palsy earlier on. And so, friends, let's pick up on that next week. And I'll tell you a little bit more about bronchial palsy and the journey with that, and then combine it then to cerebral palsy, autism spectrum disorder. Have you gone through so much trouble in your life that you feel like life is being squeezed out of your lungs? Keep your head held up high. God has got your back. You are destined for greatness. Defy the odd and be a testimony that you are meant to be. God bless you. Let's connect next week again. Beauty out of Maya, the story of Raziela Miracle, defying the odds of cerebral palsy and autism spectrum disorder. Thank you for watching. God bless you.